So the next condition that I'm going to talk to you about is multiple sclerosis, and this is another area that we have an awful lot of clinical trial data to support the use of cannabis-based medicines. So just to start with a little bit about a bit of an overview on multiple sclerosis. This is a condition that affects the brain and the spinal cord. The problem is that your nerve fibers, which are normally protected with this layer called the myelin sheath, that deteriorates, it degrades, and so the nerve fibers become exposed, and that can lead to a lot of symptoms such as visual changes, numbness, tingling, weakness, paralysis, vertigo, dizziness, urinary incontinence because of the nerves that would normally tell you when you need to go to the bathroom, muscle spasticity, tremor, slurred speech, and fatigue. So there's an awful lot of, because all of your nerves are affected in multiple sclerosis, there are an awful lot of symptoms. It's most commonly diagnosed in people in their 20s and 30s, and it is the most common cause of disability in young adults. And currently there are 2 to 3 million people worldwide who suffer with multiple sclerosis. The story of cannabis-based medicine use in multiple sclerosis is quite similar to the story in epilepsy, in that it started with a strong anecdotal evidence that patients with multiple sclerosis were self-medicating with cannabis in order to relieve their symptoms. So we have widespread anecdotal use in the MS community, and this led then to researchers doing clinical control trials to try and establish whether or not there is effectiveness for cannabis-based medicines in a variety of different endpoints of multiple sclerosis. I've already mentioned to you the data in MS-related pain, and there have been 11 clinical trials that have looked at the use of a cannabis-based medicine in reducing MS-related pain, and 9 of these met their primary endpoint. So they were predominantly successful, that different cannabis-based medicines, including Sativex, can reduce pain in multiple sclerosis. And Sativex is licensed across the world now for in MS, but it's actually for the reduction in spasticity, which is the muscle tremors that are associated with multiple sclerosis, because the data was stronger for a reduction in spasticity than it was for a reduction in pain. And I will talk to you more about Sativex in the next slide. But in terms of other products that have been looked at in multiple sclerosis, there have been 10 randomized controlled trials that have looked at cannabis as a whole plant product or an extract, and 7 of these did not see a benefit of whole plant cannabis in multiple sclerosis, and this is looking at in nearly 800 trials. So there does seem to be a benefit of Sativex, of the 1-to-1 ratio of THC and CBD over whole plant in multiple sclerosis. There's also been some trials, 4 clinical trials that have looked at THC alone, and they found that these were not effective at reducing spasticity in over 1,000 patients. So again, the combination of THC and CBD seems to be superior than just THC alone. There were some positive effects of THC. So for example, there was a significant improvement in bladder dysfunction, so either incontinence or having to go to the toilet a lot during the night, which is called nocturia. So these were improved with THC in these trials. So let's look at Sativex in a little bit more detail. How is it that it got approval for use in multiple sclerosis? So we've already talked about the fact that it's a 1-to-1 ratio of THC and CBD, and it comes in a sublingual spray which you use as and when you need it. And on average, patients tend to use between 10 and 12 sprays of Sativex per day. Now, when you put THC and CBD together in a 1-to-1 ratio, there is some magic in the pharmacology that CBD seems to be able to reduce the psychoactive effects of THC. So patients who are using Sativex don't feel high. They don't feel as altered, at least psychotropically altered, as they would do if they were just taking pure THC. Plus, you have the additional benefits of the therapeutic benefits of CBD. So CBD reduces the side effects of THC, but also adds in an additional therapeutic component. There is also about 5% of other in Sativex. So there are other phytochemicals present in the product, at least 5% are other phytochemicals, and that is not disclosed what they are, so that's proprietary. So in a way, you can think of Sativex as being a 1-to-1 THC CBD product which is enriched. So it does have other phytochemicals present, so it's a bit more like an extract in that way than a purified product. So it is licensed across the world. So many regulatory bodies have looked at the data with Sativex in multiple sclerosis in terms of the treatment or the reduction of spasticity, and found that the data was sufficient to say that Sativex could be licensed for this indication. And there have been more than 18 trials, clinical trials, that have investigated the reduction in MS spasticity, covering nearly 1,800 patients in total. So in terms of the level of confidence that we can have in this data, we can be very confident that across large numbers of patients in multiple trials that Sativex reduces spasticity. There are many meta-analyses of Sativex because there are so many trials now looking at this medication, and we can see that it is quite well tolerated because of the 1-to-1 ratio. We don't see as many CNS side effects of Sativex as you do with pure THC. And there are other findings in MS patients which are improved other than spasticity. We've already talked about the improvements in pain. So a lot of the pain trials with Sativex were positive, but clearly there wasn't sufficient data for regulatory bodies to think that Sativex could be licensed for reducing pain in multiple sclerosis. But other secondary findings that were significant with Sativex include improvements in walking time. So people with progressed MS often have mobility issues. Lots of improvements in bladder dysfunction, so reduction in incontinence and the urge to go to the toilet at night. And also this global impression of change. So just in general, patients feel a lot better. And that was either when the patients themselves were asked, or when their carers were asked, or when their clinicians were asked. All suggest that there is a benefit of Sativex globally in improving the symptoms of multiple sclerosis. And there were also improvements in sleep. So people with MS were able to sleep better when they were using Sativex in terms of the sleep quality and less frequent waking at night. So because we have so much data with cannabis, cannabinoids and Sativex in treating the symptoms of multiple sclerosis, there is actually a systematic review of systematic reviews available. So this is really the top of the hierarchy of evidence in terms of analysis. So this systematic review of systematic review found 11 eligible systematic reviews, providing data from a total of 32 different studies. And this was looking at all types of cannabis-based products now, not just Sativex. So they found at least 10 of these randomized controlled trials were of moderate to high quality when they did critical analysis of the randomized controlled trial to establish how much confidence they should put in this data. And this systematic review of systematic reviews concluded that there is sufficient evidence that cannabinoids may be effective for symptoms of pain and or spasticity in multiple sclerosis. So again, they're talking about all cannabinoids, not just Sativex, or at least all cannabis-based products, not just Sativex. They say that there is probably insufficient data to conclude on the effectiveness of cannabis-based medicines for symptoms other than pain and spasticity. So what is the preclinical scientific research that supports the use of cannabis-based medicines in multiple sclerosis? So again, we have quite a lot of scientific data that has established the mechanisms of action of cannabinoids, specifically THC, in neurological disorders like multiple sclerosis. And some of the things that THC have been shown to do in these preclinical models are to reduce neuroinflammation, so the amount of inflammation around in our nerve cells and in our brain cells, to improve the blood-brain barrier function. So the blood-brain barrier is this very specialized barrier that really keeps things out of the brain that shouldn't be in the brain, so that the barrier at the interface between our blood vessels and our brain is really quite tight and doesn't allow much things to cross into the brain, but in disorders like multiple sclerosis, that can get a bit leaky, and so some things that are in our bloodstream can access our brain, and you can have increased inflammation in the brain because of it. And one of the things that cannabinoids do is to prevent that blood-brain barrier from becoming leaky. And it stops white blood cells, so that's leukocytes, it stops white blood cells from infiltrating into the brain and causing even more inflammation in the brain. Cannabinoids have been also shown to try and prevent the problem in the first instance. So I mentioned that the issue with multiple sclerosis is that this protective sheath around our nerves called the myelin sheath degrades, and cannabinoids have been shown to cause remyelination. So to restore that barrier function, and also axon preservation. So the axons are the long cell bodies of our nerve cells. Another thing that cannabinoids do, which is beneficial in multiple sclerosis, but also in lots of other neurological conditions, is to prevent excitotoxicity. So lots of the neurotransmitters of our brain, if we have too many of them present, it causes a toxicity effect. And so cannabinoids have been quite well shown to reduce neurotransmitter release in the brain, and so reduce the toxicity that can happen when there is excess neurotransmitter release. And like in other conditions, the mechanisms of action of THC have been shown to be through multiple receptors. So there's a role for CB1 activation, CB2 activation, GPR55 activation, which we've already mentioned in epilepsy, and also this other receptor called PPAR, which is a nuclear receptor and helps with the anti-inflammatory effect of cannabinoids. So this has been well established for THC. We know how it acts, what it does at a cellular level. And there are other phytocannabinoids that have also been shown to be effective in multiple sclerosis. So for example, cannabigerol has been shown to be very effective, and this is something that is yet to be translated into clinical research. But should we be able to give cannabigerol, pure cannabigerol, or cannabigerol in combination maybe with CBD and THC, that could lead to a more effective medication or cannabis-based medication in multiple sclerosis. So the next neurological condition that I'm going to talk about is Parkinson's disease, and this is a motor dysfunction disorder. So Parkinson's disease is caused by a loss of nerve cells in an area of the brain which is really important in the control of motor function. And there particularly is a reduction in one of the chemicals, neurotransmitters in the brain called dopamine. And like many other neurological conditions, there is no cure for Parkinson's disease. So without dopamine in these critical motor function areas of the brain, what this translates to in terms of symptoms for a patient is that there can be involuntary shaking of particular parts of the body, which is known as the tremor, slow movement and stiff and inflexible muscles, depression and anxiety. So there's a lot of other kind of psychiatric comorbidities with Parkinson's, such as depression and anxiety, problems with sleeping, memory problems, and balance issues. So there's a lot of symptoms with Parkinson's disease. It tends to develop when people are over 40, although there can be a small number of people who develop it, over 50, but there are a small number of people who develop Parkinson's disease when they're under 40. And globally, Parkinson's affects between 7 and 10 million people worldwide. So what clinical trial data do we have in Parkinson's disease that supports the potential use of a cannabis-based medicine? So there are some randomized controlled trials that have been done in this area, and they're all quite small. So the first of which that I'm going to tell you about is a small trial with 21 Parkinson's disease patients who used 300 milligrams per day of CBD. And in this study, they found that CBD improved quality of life scores, but not motor symptoms. So there wasn't an improvement in the motor dysfunction, so the tremors or the inability to move with CBD, but there was an overall improvement in quality of life. There was another small randomized control in 19 Parkinson's disease patients, and they used an oral cannabis extract. But this study found that the oral cannabis extract had no effect on patient symptoms. There's a study that looked at nabilone, which is the pure THC, and this was a crossover trial. So if you remember from my lecture on clinical trial design, each of the patients in this study will have spent some time on placebo and some time on the THC therapy. And they found that THC reduced the levodopa-induced dyskinesia in Parkinson's disease. So in Parkinson's, because the problem is that you don't have enough dopamine, one of the treatment strategies is to give dopamine in the form of levodopa. But that can itself have a side effect and cause problems in movement. And in this study, what they found was that nabilone was able to reduce the side effects of levodopa. And if we look at the clinical trials registry, we can find that nabilone THC is still being pursued in Parkinson's disease for the treatment of the non-motor symptoms. So all of the other aspects of Parkinson's disease other than problems with motor function. So what about the scientific research in Parkinson's? What do we know about the effectiveness of cannabinoids from our preclinical literature? Well, again, there's an awful lot of research investigating the mechanisms of cannabinoids in Parkinson's models, and this is an area that we have quite a lot of research on. So similar to what's been shown in multiple sclerosis, it's been shown that cannabinoids suppress excitotoxicity, and the oxidative and inflammatory damage that causes the degeneration of the dopaminergic neurons. So cannabinoids can prevent that loss of dopamine that leads to Parkinson's disease. They reduce inflammation, oxidative stress, and excitotoxicity in an established disease model. Cannabinoids reduce the bradykinesia, so this is the slow movement, that's what bradykinesia means, in a model of Parkinson's, and also reduce the side effects of the current medication, which is levodopa. Cannabinoids can also stimulate neurogenesis, which is the development of new nerve cells. The mechanisms of action of cannabinoids in Parkinson's disease involve the CB1 receptor, the CB2 receptor, the TRP receptor, the ion channel TRP that's also involved in pain and in epilepsy, and also another one of these nuclear receptors called PPAR gamma, which helps with the reduction in inflammation that's seen with Parkinson's disease. So we have quite a lot of preclinical literature that supports some of this clinical trial data that cannabinoids or cannabinoid-based medicines could be useful in Parkinson's disease. There are other phytocannabinoids that also work. So cannabigerol, THCA, and THCV have all been shown to reduce symptoms in preclinical models of Parkinson's disease. So it may be that one of these molecules will be taken forward in clinical research.